Hello everyone. Once again welcome to our MRCOG3 MADC group. MADC. Today we are discussing subfertility. The module subfertility. Two topics from subfertility. That is so equally important. There are few things which are you should remember in subfertility module. That is same as usually not as other any other module. You have to take the information from and from the couple. Couple are involved here. Sometimes say one couple only, one partner will be there. Sometimes, for example, azoospermia, that is you have to maintain the confidentiality, or ovarian failure. Some conditions, then you may have to give the one couple, you may have to meet one couple only, giving importance to the confidentiality. Then there will be relevant investigations, you have to make a diagnosis. Counseling is very important in subfertility. Counseling and provide appropriate treatment. So here, what things you should keep in your mind: confidentiality, counseling, legal and ethical issues. So the ethical aspects of the assistant reproductive technologies. So you have to know about all these things, especially NHS funding and for the IVF. So assistant reproductive techniques, IUI also. And then the ethics is very important. Gamete storing. You need to know basic things about the IVF, ICSI procedure, gamete storing, and gamete donation. Then including IUI donor insemination, what are the indications and all. So then you have to always rule out communicable diseases in a couple before going for any procedure like IUI or IVF. So you have to do some screening tests like HIV, hepatitis B, C, and rubella. And tubal patency has to be checked. That is by doing it simply. First preference is the HSG, that is cystosalpingogram, not laparoscopy. And then tubal, basic thing is that. But if any risk factors, and if you have to do the laparoscopy for any other indication for the pelvic problems, then you have to go check you can do the tubal patency. Then here, MDT, usually the fertility consult specialist will come into picture. The embryologist, the fertility specialist, andrologist, they come into picture. So that is MDT. Then you have to take the routine history, the complaints about their marriage, or their staying partner, they are staying as a partner or marriage. Then you have to say about their problems, marital status, whether how frequency of the coitus, how frequently they are, do they face any issues during coital, the active action, that is whether for both male and female. For female it will be vaginismus, for male it will be erectile dysfunction, premature ejaculation. So these are the things you should keep in your mind, the frequency and whether they are facing any difficulties. This is the one thing. The second thing, whether they are using any safe sex practices. That means when they're not planning pregnancies. The other thing is the sexually shared infection, always transmitted infection, but you can tell the patient sexually shared infection. That is common. The symptom being fever, pain abdomen, false smelling discharge. So these are the things you should ask. And then living relation, with how long they are in relationship. And also you can ask whether they have a child, both partners, from for the female and the male partner, whether they have a child with the previous relationship. So these are the things keep in your mind. And what are the common stations which you are you're expected to get? One is from the male point of view. You can get a male azoospermia or severe oligospermia. And then here you have to maintain the confidentiality. You are always, you should not disclose without the permission to the other partner. Male partner to female, female to male. Don't disclose anything without their permission. Then from hypothalamic amenorrhea, that is so that's commonly, it is they have low BMI and severe exercise they'll be involved into. This is commonly asked hypothalamic amenorrhea. Hypergonadotropic hypergonadism, hyper. It's ovarian failure. That is, for example, Turner syndrome. You can expect hyperprolactinemia, and then and amenorrhea. You can expect where you need to treat the prolactin and they will conceive. Then polycystic ovarian syndrome. Then obesity and fertility, how it is affecting. So extremes of BMI, very low BMI, very high BMI. Then fertility preserving techniques, which are commonly asked. Same-sex couple, which is frequently asked. Same-sex couple, single parent also you can get. So then other thing is congenital abnormalities of the uterus, like absence of the uterus or developed uterus. That is one thing. And in some cases, uterus will be removed due to various reasons, like malignancy or anything. So they want to conceive. So that is post-cystectomy. So without uterus, a woman comes without uterus, either without uterus or with the underdeveloped uterus, where they cannot conceive. So like Mayer-Rokitansky the syndrome. So we are going, this is what they're commonly going to ask. Now, coming to the today's topic. So this is what the case is in front. It's a simulated patient task, and you are ST5 posted in gynecology clinic. It is always gynecology. Now sometimes there will be fertility clinics also, but here she comes with a complaint which is related to gynec complaint. So they come to gynecology clinic. Now you have to she see which clinic she is. You are about to see 18-year-old Alexa Roy, and with complaints of not attaining menarche. She is referred by her GP. The examination findings, blood test, and ultrasound scan reports are here. They're given. You just go through them. And she has additional factors sometimes they give. So she has radial dysplasia and BMI 24. So quickly it is not, you think about it's normal, height also is normal. Examination findings, breast Tanner stage they have given. So they are normally developed, abdomen no abnormality detected, and per speculum short blind vagina. And other thing is the blood test. So now you have an idea in your mind that this case is what. Then coming to the other thing, examination find after that blood test, they have again check, confirm name, age, and NHS number, which I always tell you. And the hormones are normal. Quickly go through the hormones and quickly the normal values also. You may not know, sometimes you may get confused. Quickly go through the normal reference ranges also, and you see basic things hormone they have done normal. Scan report is enclosed, that also confirm name, age, NHS number. Uterus is not seen, ovaries are normal, karyotype is normal. So now here you have to 10 minutes in your that where you always it is like that, and where you have to take the relevant history, interpret all the results what are given, interpret them, discuss the implications for future, what problem she is facing and what problem she want to get what is a concern, address those concerns. Now here karyotype is 46XX. Always here two things which should come into your mind. One is Mayer-Rokitansky Kuster-Hauser syndrome, that is Mrkh. The other thing is androgen insensitivity syndrome, that is a XY. So what are the differences between these two? You always should keep, and these are the two things which you should keep in your mind. So one is androgen insensitivity syndrome, and one is Mayer-Rokitansky Kuster-Hauser syndrome. So now this case, you know that it is uterus is absent. It is a female karyotype. It is female and all the things are normal. So from the scan report, you know that the uterus is absent. Now, with this thing in your mind, in your background, then you have to proceed with the case. Now we are addressing the role player. So now start the case like, hello, I'm Dr. Manjula, one of the doctors in the gynecology clinic. May I confirm your name and age, please? I'm Alexa Roy, 18, doctor. How may I address you? Alexa, doctor. So how are you doing? She's young. Just wish her. How are you doing? She's very young. How are you doing today? I see from your notes, the introduction is over. I see from your notes agenda is that you have some concerns with your periods. And you have done some blood test and also a scan. You have done a scan also. And you're here to discuss about them. Correct? Am I correct? Then, do you have any idea about a scan report? Just we need to know whether she knows or not. She said, no, doctor, I don't have any. Nobody told me. Yes. Okay. Alexa, let me tell you. Let me tell you. Whatever we discuss will be confidential, because from this station itself, you know whether it's a confidentiality station or not. Because uterus is not there, she may not like others to come to know about it. Or you can say, I see that you're alone here today. That also you can say, because they usually come alone. I see that you're alone here today. Now, Alexa, let me tell you, whatever we discuss will be confidential. Always say in the beginning. No one will have any access to our discussion. And now, before I address all your concerns, can I get few details from you, which helps in our management plan? Yes, doctor. So, can you tell me more about you? Open question. And then she will say, what is her problem? You know it is amenorrhea, but let her say. Then, doctor, I'm 18-year-old, and so far I have not started getting periods, and all my friends have already started getting, but I'm really worried about it. So then you say empathy. I'm very sorry to hear about it, Alexa, but we are here. Bring down the tone. We are here to help and help you, and I shall address all your concerns. And Can you tell me whether how few let me ask you a few more things. How was your growth spurt? Did you notice were you having growth spurt at the correct age? And I see that your height is normal. That's 165 centimeters because it's given. You just say. How about your hair? Few things you have to ask about the secondary sexual characters. How about your hair growth in the armpits and down below? And so, then second, breast. Do you feel that your breasts are normally developed? I know it is given in this thing, in the case scenario, but you have to ask whether she knows that it's normally developed. Second, so first thing is hair growth spurt. Second thing, breast development, the hair growth. Then third thing is breast development. Then coming to the other things you need to ask, because this condition is associated with some other associated conditions. Here they gave radial dysplasia. So I'll tell you in the later on what all conditions are associated with it. But you should know about Mrkh thoroughly. So do you have any problem with the waterworks? Do you have any hearing difficulty? Any problem in the neck? And do you have any problem in your hand, right hand? Are you able to do work with your right hand? Any problem with, do you have any pain in the chest or any shortness of breath? So, this is why you are asking all this, because you want to rule out other associated conditions like heart. There can be heart anomalies like bicuspid aortic valve can be there. Heart anomalies, there can be skeletal abnormalities, especially neck. The spine of the neck can be affected, and also kidneys, renal. So renal can be affected. So these are the things that keeping in your mind you need to ask related questions. Then now, so this is about the history of present illness. Then signpost. So now sexual history. Sexual history, because she is 18. So we need to ask that. So can I ask you a few personal questions? Always signpost for the sexual history. Can I ask you few personal questions? Yes, doctor. Are you sexually active? She may say yes or no. So if she says yes, then you say, do you face any difficulty or any pain when you have this when you have the sex intercourse? So then she says yes or no. Then she will say pain and difficulty. You ask, do you practice any safe sex practices? If she is sexually active, do you practice any safe sex practices? She will say yes or no. Then that is about the sexual history. Now there is no point in asking about the smear, because she is not having any this thing, uterus is absent. Then on medical history, are you on any long-term medication? Because we want to know whether she has any heart problems. I told you. So on any long-term medication for. Then do you have any allergies? Can you tell me do you know your blood group? Because it's not given here. Can you tell me your blood group? And so then here you have to bring out that point, the right radial dysplasia, which she comes. So in this station they can ask anything, right radial dysplasia or any heart problem, bicuspid aortic valve they can ask, or skeletal dysplasia, anything, neck problem they can ask, so renal agencies, anything they can ask. So depending upon that you put ask those questions. You need not know much about them, but basic idea you should have. So I see that your right forearm is not developed properly. When did you notice it? Then she will say from my childhood. Did you consult anyone? And have you undergone any treatment for that? Like operation or anything? Have you undergone any treatment? So whatever she says, you note down. Any other operation have you undergone in the tummy or down below? Any family history of similar problem? Because they can run in the family sometimes. Any family history in the any other in similar problem or any other concern? Then smoking. Do you smoke? Take alcohol? And recreational, pardon me for asking, do you take any recreational drugs? I see that your height weight ratio or BMI is 24. So then how is the support at home? Then with whom you are living? Sometimes she'll be living with parents or in the hostel. She may be student also, or anything. So what do you do for living? Whether she's a student, you want to know whether are you studying, because she's young. You can ask, are you studying? And is this problem making you upset, affecting affecting you? That is your mental health. Like, do you feel down or depressed? Because this is really upsetting for her. So just find out that. And then because you are not getting periods, is it upsetting you? So this is about the information gathering. Alexa, would you like to add anything? Yeah, because already she will say yes or no. Now, Alexa, anyway, examination findings are given. So no need to ask that you want to go to examine her. Already findings are given. So now, coming to the discussion. That is the clinical knowledge. Alexa, let me explain to you about your condition. And I shall address all your concerns. I shall explain to you the condition. I shall address all your concerns and also take you through the management options, management plan and options. So, will that be fine? Yes, doctor. I have reports, your reports with me. I have confirmed your name, age, and NHS number on your blood reports and scan report. Together, you say blood report, scan report, and the genetic report. Hmm? So, your hormones and the genetic tests are normal. It shows that they are normal. And then you are ovulating. And coming to the scan report. So, normal things you tell first. Coming to the scan report, I see that the womb or uterus also you can say, womb is not seen, that is absent, and slowly make it slow. Ovaries are normal, and from your history and from your report, you have a condition called Mrkh. So Mrkh is otherwise called Mayer-Rokitansky-Kuster-Hauser syndrome. If you say such a big word initially, she may not understand. Just you say Mrkh. That is Mayer-Rokitansky-Kuster-Hauser syndrome. That is in the medical terms, we call it as that. And I'm very sorry to give you this difficult information, Alex. I'm very sorry. Just pause. Slow down, pause. Sometimes she may break down because it is uterus is absent. So she'll become break down and she cries. Offer her water and tissues, even if they're kept on the table or not, you offer them. Just take some tea water, say this thing. Are you so shall we continue this conversation? Uh, Alexa, we are here to help and support you. Can I proceed? Or would you like to reschedule the appointment? Your appointment. You need to ask. Usually they won't ask to reschedule, but you have to ask because they will be very upset. They will not be able to face you, continue anymore. They want to reschedule in real life. So the role say, no doctor, tell me. So now you can't call somebody to be with her, no BBN because confidentiality. Now, sometimes she may ask, What is it, doctor? What is this condition? It's such a complicated name. And how it happens? So, now it is, you say, draw a diagram. Draw a diagram. It is a condition present from the birth. That's why it's called congenital abnormality. Normally, around fifth week of baby's development inside the mom's womb, there are two ducts called Mullerian ducts which fuse to form uterus, neck of the womb, and upper two-thirds of the vagina. Sometimes these ducts they fail to form, leading to failure of development of the womb, the neck of the womb, and upper two-thirds of the vagina. So they don't. So this condition will lead to. So that's why they don't have periods. This is called primary amenorrhea. They don't have periods. And then this condition in medical terms is called Mrkh syndrome. On the other hand, let me tell you, our ovaries are normal. The ovaries are saying they're normal. And from the hormones also, we know that they're producing eggs. And so they produce egg. They're producing eggs and they're also producing female hormones, which are important for the woman's health and also sexual development at the puberty. That is why your breast normal. There is normal development of your breast, and also the pubic and axillary hair is there. So these are the secondary sexual characters. They're normal. So no need to take any hormones for those things. So that is HRT. No need to take hormone replacement therapy. The underlying cause is not known. I'm sorry to say it's not known, Alexa. Am I clear so far? Shall I continue? Yes, doctor. I would like to say some other abnormal structures also can be affected along in this condition, causing various developmental defects, like they can affect the bones. The bones, there can be some bone abnormalities and skeletal abnormalities. Like in your case, you have the right forearm is affected. This condition is called radial dysplasia. So like that, similarly, heart can be affected. Heart, kidney, neck also can be affected. So if depending upon that, our special doctors will be taking care of you. So then the other thing is coming to the sexual life. You said that you have a difficulty in having pain and difficulty in having intercourse. So Sometimes this condition, some people face this. Some people can have normally, they don't have any problem. But some people will face this difficulty because the upper part of the vagina, you draw and you are already drawn, no? Show in that picture. Upper part of the vagina is not developed. So we are here to help you. Our specialist doctors are there to make you have a comfortable sexual life. And then also in future, when you plan pregnancies, when you plan to have kids, we will help you to have a pregnancy also and babies also. So our specialist team of doctors called multidisciplinary team are there to help you. Now, coming to your sexual life, because you're facing problem with the sexual problem, you're facing this problem with the sex, that is pain and difficulty, and because of the short vagina, then we can do some vaginal stretching using vaginal dilators. These are the smooth cylinder-shaped objects designed for this purpose. You can be helped. You can be helped by our clinical nurse specialist. If you cannot understand, she will be there to help you. And once you are comfortable with one particular size, you can continue with that. Then you can have sex without that also. This is the first line of management. That is, it is 95% successful. They're happy with this treatment. But if it's not successful, still you have pain, then we may have to do a small surgery from down below and also a keyhole surgery done under sleep medication. So that I will tell you, if this fails, we will discuss more about that procedure, the surgical procedure. Then coming to the other thing about in future, suppose she can ask, if she asks, doctor, will I be able to have a child? Because there is no uterus. Then if she asks, or if she doesn't ask, you can say, no, coming to the, if in your future, when you plan to have a child, there are some options. And because you do not have womb, I'll tell you about the options what we have. So our specialist, we will refer you to our specialist doctor, that is a fertility specialist, who will help you and they discuss the options with you to have baby. So the one option will be surrogacy. That is, I'll explain to you. Am I clear so far? Yeah. Can I explain to you all this, all the options? Yes. Always take a permission and go forward. And tell in chunks, bits. Don't continuously finish off the station. Surrogacy. So this is surrogacy. That means you have ovaries. And so we give you medication, injections to make ovaries produce more eggs. And once they develop, they're collected and fertilized with your partner's sperm to form a baby. That's called embryo. So, and throughout the scan is done to check the development of the eggs. Then these embryos are placed in another woman's womb who carries your baby with her, if she, after taking her consent. So, who is willing to carry a baby. And once the baby is born, she will be handing over the baby to you. That is called surrogate mother. So this is one, this is there. So baby is biologically yours because it is your eggs and your partner's sperm. So baby belongs to you. So this is done. This surrogacy is done through test tube baby. That is called IVF, in vitro fertilization surrogacy. So then, and then the other, this is one option you can have. The other option, what I can tell you is uterus transplantation. That is, somebody's uterus, donor. That's donor's uterus will be transported into your tummy. That like heart transplantation, kidney transplantation. This is done. But now it is in the early stages. It is not very readily available and it's very expensive also. However, it will be available to many very soon. Then here, the advantage is that you will be carrying your baby. So then you'll be the biological mother also. The other option, which is, but it can have its own risks of surgery. It is a major surgery. It is done in a tertiary center where with all expertise and facilities, and it can have its own complications of the surgery and also complications of the sleep medication. That's anesthesia. So then coming to the that is, you can say if you have time, but there may not be time, that bleeding, infection, injury for the surgery. Then coming to the other option, adoption. If you don't want to undergo all these surgeries, if you don't want to, not willing to undergo not willing for surrogate mother, whatever options I gave you, if you're not willing, you can go for adoption. And some women choose this option. The other thing, the last thing is, some women prefer to be childless. So they're happy with what they are. So these are the options which I have explained to you. Then So then the other thing is, doctor, then do I need, okay, am I clear? Then you say, doctor, do I need to use any sexual protection when having sex? So it's better to practice, you say, it's better to practice safe sex practices because you are at risk, still at risk, you're still at risk of having sexually shared infection with some bugs, like bacteria or viruses. So better to use condoms or then, but do you need, then anyway, there's no role for contraception. You need to know. You need not tell her, you need to. Because some people who are too innocent, they'll say, do I need to use contraception? So, because the ovaries are functioning. So, but you say, no need of contraception, no need of cervical screening. So, but unnecessarily don't ask. If she asks, you can say. So then, now that I have explained to you about issues that can be faced in this condition, you can think and decide. You can, if she has a partner, if she is planning for pregnancy, she can think about. If she has a problem with the sexual intercourse, then that also she can discuss and tell you. Then shall I tell you, take you forward from here? Yes, doctor. Now, as you have problem with your hand, we will be referring you to the plastic surgeon. So he will, and also the occupation therapy and physiotherapy, because whatever problem comes in the station, you have to address that. Then the other thing, so you are referring her to the plastic surgeon for the hand, occupation therapy and physiotherapy. The second thing is, we will arrange a scan for you, and also a 2D echo for the heart. And sometimes we may have to do an MRI, special imaging called MRI, to know whether there is any problem in the heart, in your heart or kidney, and also the backbone. The third thing is, we will refer you for the genetic counseling. Genetic testing has to be done to detect genetic testing, though the genetic testing has been done, but we need to do in detail, detailed testing. So, and as it, if it comes abnormal, that means there is 1 in 2 chances of having the passing on this condition to the baby. So then, if it comes as abnormal, but we cannot say how the baby is affected. So, on the other hand, if it comes as normal, the so then it is still difficult to predict that the risk of passing this to the baby, that is 1 to 5% chance is there. So now, because this can, if suppose you feel that it's affecting you mentally, we'll arrange a counseling for a psychological support. And then this is the am I clear so far? Yeah. Now, this is the information leaflet, written information leaflet about what we have discussed. Then I will connect you to the support group as well. So people who are facing similar condition, you can talk to them and discuss your problem. I mean, you can talk to them so that you will have idea that people are there like this. Then I'll give an appointment with my consultant to discuss more. If you have any more doubts, you can discuss, and you can tell us what you need to have, what type of treatment you need to have. And once you plan to have a baby, we'll refer you to the fertility specialist. So do you have, Alexa, do you have any other concern? Do you have any other concern? Thank you for your time. So this way we have to take the station. Okay.